An official welcome to Rising Practices and Policies in Our Workforce Spring and Summer Learning Series. My name is Leora, she, hers. I'm based here in Northern California on unceded Ohlone land, and I am the School Mental Health Field Director for the Pacific Southwest Mental Health Technology Transfer Center. And we've got an incredible lineup to join us today in this conversation. A quick note that we are grateful that we're funded by the Substance Abuse and Mental Health Administration. All the opinions and expressions that our faculty and that we share today are our opinions and our opinions only. I get to be your moderator for this session, and then we'll invite our panel to come on, and each person will have 10 minutes to share their thoughts from the breadth of higher education to social work, pre and in service, to how to create state systems of of retention and recruitment. There's such a diversity on our panel today, so I'm really looking forward to that. So here we are, session 4 of this series. I want to offer a moment of grounding and shared language around why we're even in this conversation. We have a community of practice for our advancing wellness and resilience in education leaders, state leaders, and many months ago, our leaders who were looking ahead at state education agencies said, we need a conversation about retention and recruitment. We need to stop saying there's a teacher shortage, but actually there's a systems failure, or as some of our faculty might say, a systems doing it exactly as it's been setting up to do and now leading us to these outcomes. And so we're at this inflection point on August 8th, in this moment of having a huge rise for mental health services in our communities, and one would also argue a huge shift in our collective consciousness, and potentially even a decrease in stigma. So a lot of folks saying, yes, I need help, and yes, I want help, and also I'm interested in how to help. And we're also experiencing a large attrition of providers, both from our mental health providers and our school mental health providers, because today we're talking about both and. I'm using the word attrition because that gives us a call to action that people are choosing to leave. And so part of what that offers us to do is to ask, why might that be? So I just want to offer that on the left-hand side, you see that SAMHSA is predicting that by 2025, we'll have shortages of the following professions, so school counselors being the top. That might have to do with the school counselor ratio that exists in our country. Many of you who have been school counselors are like 1 to 800. Well, that feels like a pretty intense work experience. So I'm inviting us as moderators for the session to shift our language less from how do we get school counselors in the system to how do we re-examine the ratio that might then set up school counselors to feel seen, dignified, safe, and full of agency and belonging in their role. I also want to note that on the right-hand side, I've pulled the National Council for Behavioral Health's demand in 2030, which gives us a noting that the demand for addiction counselors and mental health counselors, and particularly psychiatric nurse practitioners, is also going to be rising. So I want us to hold both where the need is going to be coming and is here, and also how we might then think about preparing and recruiting and changing the language around these potentially incredible experiences of professionalism. So the last couple pieces before I move it on to our incredible faculty of today, I want to offer where we might need to go after where we are, which is that part of when we think about recruitment and retention, I'm going to invite us to think about it in 3 ways. One is an individual skill and capacity approach. So how do we think about the relationships that might help us navigate retention, and how do we think about the training for current and emerging needs? If we know that home insecurity is an emerging or in front of us need, how do we then refocus our training for competencies in our skill force? The second is on systems and infrastructure approach. So I want to really name that oftentimes it's the small but the really big things that impact the workforce to decide to leave a job. Some of them might be family leave policies. Some of them might be reproductive and family building benefits. Does your workforce and your system provide support for those in the system, particularly workforces that are historically feminized to have reproductive care, bereavement leave policies, and equitable and transparent compensation. And then the last piece in this conversation is also on the management leadership approach. For you, for me, as a manager or as a leader, how do we think about centering safety, belonging, and dignity? How do we reframe what even professional behavior looks like? So we move from the dominant culture's definition of professionalism, which has roots in white supremacy, and into a more rooted, respectful, reflective conversation around how we show up at work and the beauty and diversity of wisdom. And I really recommend you to check out Untapped Leaders to learn more there. Then the last two are on crisis management and leadership and skill building. So how do we build trust and how do we repair trust as leaders? And how might that impact the way that we're able to retain folks that are really experiencing deep. Next, moral injury. Moral injury refers to the experience of when you believe that who you work for is not doing the right thing, or when you believe that who you work for is doing something that they should be doing, and it isn't happening in the way you do believe. And sometimes that dissonance can relate and contribute to wanting to shift jobs. So all of those three things: skills, systems and infrastructure, management, and leadership. And our four panelists that will meet right now.
Thank you, Leora. It is an absolute pleasure to be here with you all today. Thank you for spending part of your afternoon or morning to join in this discussion and conversation. My name is Katie, and I'm a school psychologist. I'm the director of the School-Based Mental Health Grant at Nevada State College. I serve on the Leadership Assembly for the National Association of School Psychologists, and I also sit as a board member of the state board in Nevada. And why I share those particular experiences with you is it's through that practitioner lens, the higher ed lens, and a policy lens that a lot of this work that we're doing at Nevada State College is based upon. So one of the things that we're experiencing, not only in Nevada, but across the country, are extreme workforce shortages. And those are based on the very thing that Leora mentioned as the ratios. So when we're talking about school-based mental health in the school setting, school psychologists have a recommended ratio of 1 to 500, and school counselors and school social workers have recommended ratios of 1 to 250. And in Nevada, we are up to 4 times those ratios in our schools. So what that means is 78% of our students don't have access to comprehensive psychoeducational supports in the school setting. In terms of actual numbers, we are short 770 school psychologists, about 850 school counselors, and about 1,400 school social workers. So there's that one piece, the workforce shortages, but then there's also the training piece that goes along with that. And we're also experiencing extreme shortages of training programs as well. And I know this is a phenomenon across, especially the Western region. So this region 9 is a perfect audience for this discussion. In Nevada, we have one higher education training program currently for school psychologists, and they graduate about 12 students per year, and about 6 enter our workforce in the state. So with the need of 770 school psychologists and a system as a state that's only set up to have a supply every year of 6 graduates, it's just not sustainable. And the system itself has set itself up to perpetuate the issue. So how can we shift that, right? So if we're looking from a positive standpoint, we need to create multiple career pathways and stacked degree programs. And where this started for us in Nevada was really focusing on policy change. So through the last couple legislative sessions, we've been able to implement some good policy work, specifically in the 2019 session and the 2021 session. And then from a research perspective, putting it all together, I created the Artery Pipeline Framework, and it's been through incredible partnerships throughout the state with our state legislature, specifically Senator Marilyn Dondero-Loop, both governors, Governor Sandoval, and then recently now Governor Sisolak, the Nevada Department of Education, and now Nevada State College and our higher education partners, because it takes an entire pipeline. It's going to take a lot of work from all of our partners to get this to create a systems change that we can really see short-term benefits, but as well as long-term solutions, right? So what we're doing is we're aligning training and programmatic offerings through our workforce pipelines, and that's creating multiple opportunities with intentionality. When we're talking about all three of our school-based mental health professionals, you need a graduate degree in order to practice in most states. And so if we're looking at that triangle that we have in education, the graduate programming is up here at the top, but we don't have anything underneath it to really support and build the infrastructure to get to that point where we have individuals within that pipeline to make it to the top of that triangle. So what we've done as part of the artery, and we'll get to this on the next slide a little bit more, but starting at high school, really beginning comprehensive awareness campaigns, going into our middle schools even, and talking about what is school-based mental health. When we did surveys of our students, the majority, well, 75% of students had heard of a school counselor at the high school, because a lot of times they help with scheduling. Some students, about 25%, had heard of a school social worker, and even less than that had heard of a school psychologist. So if students aren't aware that these are career fields, they're not likely to go into them. So really raising that awareness, creating high school dual credit opportunities, licensing a psychological services assistant, and that is, if we're talking about an education setting, it's similar to a support staff professional who can support teachers, but this is a mental health professional who can support our school-based mental health professionals, specifically school psychologists, and really creating a minor in school-based mental health leading up to and supporting entry into a graduate program, and then creating graduate programs with paid internships for those necessary experiences for licensure. So on the next slide, please. Putting all this together, because it is a lot, when we're talking about shifting a system and creating new opportunities from the graduate program and the 4 pillars, you can see it represented here. Before that, it helps to have a visual to go with it. So this is what we're proposing in the state of Nevada, and what we are currently implementing here at Nevada State. You'll see the high school and then the 3 columns in the middle for the undergraduate opportunities all the way up to that graduate program. And when we put this on paper like this, in terms of what actually existed, there was zeros for all these different opportunities. The openings were huge, and the opportunities for students was, very limited, because we didn't have pipelines at the high school and undergraduate level. So through this model, and you'll see here too, based on some regulation change and some statutory change, we were able to put some of the structural pieces in place at those different levels to support the change that needed to happen in the districts and at the school levels. It's an interesting concept, because the schools are tasked with hiring and recruiting these different professionals, but they can't do it alone, because institutions of higher education and other partners are needed to help support the growth of those professions. And I know that we are experiencing similar things, but I just think that it's interesting that the systems don't always talk to each other. So this is one model that was created in which the systems do talk to each other, and it's producing incredible results. When we're talking about solutions, so one of the biggest solutions I would recommend is to shift policy to support your desired outcomes. And this might be in the form of aligning your hiring and funding to nationally recommended ratios. So, for example, in Nevada, we have statutes that mandates the establishment of ratios for school-based mental health professionals. And then through regulation, we align those with nationally recommended ratios. So now taking that down to the next level for our school districts, what that looks like in terms of policy is establishing a hiring policy that aligns with the 1 to 500, for example, for school psychologists. Some districts might have current practices of allocating 1 position for a school psychologist for every 1,800 students. So making a policy change at the district level to hire at that 1 to 500 level will give us a better target of how many open positions we truly have, and how we can then recruit and use different strategies to begin filling those positions. Because until we accurately identify what the need is based on best practice ratios, we don't know exactly what we're looking for. So then after we have allocated our hiring, we also need to align funding to go with those ratios. Again, codify the ratios and different funding incentives. There's a lot of good funding incentives out there, and the federal government has actually passed a lot of different opportunities. There's 2 new school-based mental health opportunities coming up of approximately $2 billion that institutes of higher education, SEAs and LAs can begin applying for in the near future. So that's very exciting. I also recommend, based on the work that we've done, create a minor in school-based mental health. There's no real undergraduate degree in school psychology. And so if we can create a minor in school-based mental health, it benefits all 3 professions. And then also gives students a leg up when they go to apply to graduate school because they've got this minor in school-based mental health. And the other benefit to that is they through the minor, they have field experiences in schools. So they see what it's like to be a school counselor. They see what a school social worker does, and they see what a school psychologist does on a daily basis. And they see it from the practitioner side of things, not just the student lens, which they see in working and interacting with those professionals on their campus. And so then that helps support keeping those professionals in the field, because then once they enter the field, they're less likely to leave the field, which speaks to that attrition issue, because they know what it's like to work in the school-based setting. Also develop and license that PSA position to support our licensed professionals, because if we can get more support professionals in to assist with parent phone call scheduling, those different administrative tasks, it frees up the licensed school-based mental health professional to work directly with students. Also increase awareness in middle and high school, implement a pipeline such as the artery. I also recommend looking at the Senate bills that we've created in Nevada to support this type of work, and see if that's something that might work in your individual context, recognizing that every state, every district, every community is different. But if there's these are one way to start a systemic shift in the policy to support the desired outcomes in our schools.
Really beautiful, and a lot of recommendations, both from the needs to also where we can go.
Thank you, Leora, and thank you, team. And Dr. Katie, you couldn't see my face, but I was nodding vigorously as I was listening to you, and I could certainly just, copy paste that onto the workforce that our association deeply works with. So my name's Deborah Sun. She, her pronouns. I'm the executive director with the National Association of Social Workers California chapter. We are the largest trade association that represents the interests of social workers. We have roughly 120,000 members across the nation. California chapter is the largest chapter within our association with about 9,000 members, and we represent the interests of 75,000 social workers in the state of California. And while much of the data and anecdotes that I'll share during my presentation are applicable to the state of California, I certainly want to encourage others to connect with me, and I have my contact information at the end of my slides, because a lot of what exists out there in terms of innovation and promising practices, we can certainly learn from others and vice versa. And so I just want to do a little bit of level setting, and this is, again, more so focused on the state of California, and it is, it's important for us to create space for us to reflect on and just honor what's going on with the workforce, because we refer to the workforce often, and the profession and the professionals and the clinicians, and we're human beings. And I think it's important just to make sure and create space for acknowledging that and embracing that. And so here are some data points. Again, a little bit more applicable to the state, but certainly I'm sure resonates with others as well. Post-pandemic, about 22% of our children feel they might be traumatized because of the COVID-19 emergency, with almost half of students reporting feeling depressed. That's huge. Our children are really suffering. Children Now, which is an advocacy organization in the state of California, they annually publish a state report card, just analyzing the state systems of care within the state of California, and they graded teacher pipeline and retention at a C- and behavioral health care at a D+. And I have hyperlinked here so that you all can check out the full report card and really dig into sort of what were the gaps and sort of failures of systems. Dr. Katie looked at this one up, and I'll mention it because I think this is a different take of the data point that she mentioned about the ratio, but there is one social worker for every 6,000 students. 6,000 students. That's massive. That's bigger than some schools and or most schools, I guess. It's 25 times the recommended ratio, and of course, similarly, as Dr. Katie mentioned, this is very much indicative of the shortages with other disciplines as well. And what's quite amazing is that while our children are suffering, our people are suffering, those on the front lines are suffering, the research continuously shows that our kiddos are more likely to seek counseling when it's accessible at the school site, and yet it's not accessible, and that we don't have the personnel, the human beings, the bodies, the resources that our young ones need. So our association has done a lot of work speaking to school districts, speaking to communities, speaking to community-based providers, as well as other systems of care that touch the lives of kids and families around workforce, around strategies. And so I'm just going to lift up some of the data points as well as anecdotes that we've learned in terms of what the behavioral health workforce has expressed in terms of their needs. And really, we operate from the framework of ensuring that those most impacted are at the decision-making table. And so that means, the folks of the field that are the voices that we're, certainly paying attention to. And in our association, I forgot to mention this earlier, one of the special things about the work of our association is that we not only advocate for the social work workforce, but we also advocate for those we work with as well as those we serve, and that's a value of social work. So the needs of the workforce. Support is huge. Like I mentioned, professionals are human beings as well. So oftentimes systems talk about and train professionals in trauma-informed care, whole person care, all these really fantastic evidence-based or evidence-informed models, and yet we don't practice them with the human beings that are the fuel of our organizations, right? And so, the workforce has been very vocal and very clear that they need to be cared for in addition to being able to be nourished to care. And it's a cyclical experience for all human beings. And so, honoring the experiences of people as individuals is huge. Another big piece is really, that there is pause, that there's space for pause. Life has been difficult. The world has been difficult. If there is a school-based shooting somewhere, then create that space for pause. And really, we've heard pretty loud and clear that oftentimes it's business as usual. And when that happens, obviously school settings are, prioritize education, and our students can't learn if they're not well. If they're not well, in the context of behavioral health, if they're not well in the context of their physical health, all these things. And then our providers cannot provide, obviously, if they're well too. And so making sure that there's a space for community and reflection is huge as well. And not just in the context of working at the school-based sites, but also in education spaces as well. And then supportive supervision. Folks, really want, again, to be honored as human beings, that they are doing the work and it's tough. And what does that look like in terms of the infrastructure that's existent for them, not only just to pause, but also to gain ongoing support and a space for just, reflecting about what's working, what's not, how to strengthen your work, how to be more present with those that you're focusing on. And experience is just more broadly, what is the professional experiencing? Is it in the context of a team? Does it feel like it's in collaboration with others? Does it feel like they are not only treated equitably, but their voices are included in an equitable manner in decision making in terms of a student's, a student's trajectory, or decisions around support mechanisms, decisions around programming, etc. And like I touched on earlier, the professional development piece is huge in that we want to honor folks as individuals. So it's not only about the care that they provide for others, but how are the systems providing care for that individual. Flexibilities refers to work conditions. COVID is not over. Life is not over. Life has stressors on an ongoing basis, and we need to create space for that. And wages refers to, parity in terms of the behavioral health workforce. What folks can do on a micro level, lean on coalitions, lean on your advocates. We want to hear from you. Right now is certainly a good time for us to hear about what you all need. There is help coming in the state of California. We were pretty successful in collaboration with several others in allocating about $300 million to the behavioral health workforce. And so educational stipends, internship stipends, hazard pay, loan forgiveness allocations, all these things are coming down the pike. And so stay tuned. And if you're in another state and want to see samples of the legislation and the budget ask, please just let us know, because those are all coming as well. And I'm happy to answer any other questions about the policy work, because there's a lot there. So policy work, there's actually a bill being championed by Senator Scott Wiener, which is actually a pipeline in behavioral health workforce dedicated bill. So it's actually, a piece of it is specific to the social work workforce, and then allocates funding for the Bachelor's of Social Work program to directly pipeline into the Master's of Social Work program. This structure already exists, but the funding in the bill actually creates technical assistance and additional resources to be allocated to public schools in the state of California to build additional models. We have people that want to enter counseling, psychology, social work, but the schools don't have the capacity. And I think Dr. Katie touched on this, and we need the money to build that infrastructure. And so that's actually a big piece of the 300 million that I referenced earlier. That's a big piece of those dollars. And so again, if folks want to see, what that bill looks like, or, any information about the budget ask that was successful in this cycle, all these things are coming down the pike. Our healthcare workforce department at the state level is currently working with the deans and directors of social work programs to design out what additional capacity for social work programs will look like, including the internship stipends, including the scholarships, et cetera. And so these are really exciting things that we certainly want to make sure and resource other states with in case they want to replicate it. And my contact information is here in case folks want to reach out and learn more about the policy work and/or receive any technical assistance.
Many of us know there are often bills, but those bills aren't often backed by actual funding. So glad to hear California is moving that way. Another big warm welcome to Dr. Ann Mendes, who's going to speak about a specific county program and also pre-service training here in Southern California that I know.
Hello, everyone. Thank you, Leora. It's great to be with all of you today and sharing a little bit of my lens in my work. I've been working in public education and mental health for about 25 years, and have the interesting perspective of having, been a provider, an administrator, but also now working at the university level in terms of counselor education and preparation, which has also led me to overseeing and kind of revamping a really special and unique program through the Los Angeles County Office of Education that's focused on educators, on support for educators and those that work in schools. So I have a really interesting information to share with you about both of these. My feet are kind of in both areas, but they're both very well connected. So in terms of the county, I've been with the Los Angeles County Office of Education for about going on 4 years now. And this is an in-house employee assistance program. And most districts will have and organizations will have some form of an employee assistance program. But EASE is different in that it's in-house because it's through the County Office of Education. So this is a really interesting model that I really encourage other county offices of educations to explore, because it allows, first of all, it's a low-cost options to districts. It's created by educators for educators. The providers that we get are people that work in education, that understand the barriers and the difficulties and the challenges and the systems and infrastructures of what it's like to work in schools and within districts. And so that's really important when we look at what are the individual needs of educators. So here in Los Angeles, we've been able to grow the program. Another great thing about being connected to the County Office of Education is that you're able to leverage county resources, such as funding. In response to COVID, we were able to leverage additional funding that provided support services for every single district in the Los Angeles County. And so through EASE, there's a couple of different branches. Number one, we provide a phone hotline. It's a 24/7 hotline, but I kind of call it a warm line as a support for LA County educators to talk to someone, whether there's a crisis, whether they're having a bad day, whether they're struggling with whether it's work related or not. So we do provide that kind of first level of support. We also provide mental health sessions for educators. The COVID funding allowed us to increase our sessions from 3 sessions to 5 sessions every 6 months. We also offer conjoint family counseling, which is your couples, maritals, family therapy, which is so difficult to get even through, our insurances. And right now there's such huge waiting lists for mental health services through our insurance that using an EAP, particularly an EAP like EASE, we don't have any waiting lists. Educators are able to get into services sometimes even within the same week, if not the next week. Another branch of the program is we offer mobile crisis response services, support groups, and psychoeducational workshops for districts. One of the things with the pandemic is that, I guess you would call it the silver lining, is that it really has highlighted the prioritization of mental health and support for educators. Districts and counties do a really great job of supporting our students, making sure that we have curriculum supports, positions to support students and families and communities, but a lot of times fall short when it comes to providing support to their staff, to their educators that are the ones that are providing support to students and families and communities. And so that's where this comes in. And it's really highlighted that need that educators need support too. And many districts, especially smaller districts, just don't have the systems, the structures, the funding in place to be able to kind of bring that in. So relying on your county offices of education to be able to provide additional levels of support is a really great way to do that. So this is a list of, we now support all 80 districts in Los Angeles County. And we also support community colleges, educators at community colleges. As of last year, we have now started a partnership with the Head Start and early learning programs, because those early childhood and education teachers, they were on the ground the entire pandemic, weren't able to work remote, and had great difficulties and challenges in being able to continue to work. And the level of stress, burnout, compassion fatigue, I'm sure all of you know, you're all in the field, has been just off the charts. So just kind of want to share, in working with the EASE program, some of the trends that we've been seeing over the last few years in terms of educators. One, there is a need to talk, a need to vent, and that access needs to be immediate. Sometimes with the system as it is, even being able to get an appointment for a mental health session, maybe you have to get screened first, which can take 2 weeks to get that appointment, and then being able to get your first appointment, it might be 3 months before you're actually able to get in with a counselor or a therapist. So what we have found is that having the phone line available, sometimes you're able to address, to listen, to create space for whatever is going on for that person at that time, and to de-escalate and to provide some immediate support. So we like to call, I like to call it a warm line, because it's also about what we're working on is demystifying, right? Demystifying access to mental health, demystifying and looking at that mental health stigma. And so realizing that you can call, it's an anonymous call, and have instant access to a counselor that can provide some immediate support. And what we have seen is that for many of our educators that are calling and coming into our system, it's their first time ever being in counseling, or their first time ever initiating contact to begin therapy. And so this is a really great way when we're looking at demystifying and we're looking at stigma to kind of create a space that it's not so scary. It's not so scary to reach out and get these services. And so that's why we like the warm line. And that's unlimited for educators to access. There's lots of, as somebody was pointing out in the chat, what it's like to be on the ground in schools and education is over, particularly over the last 3 to 4 years, has been very difficult, which is why we're looking at things related to attrition, retention, and thankfully we have so many positions that are available. I know here in Los Angeles, there's hundreds of unfilled positions in our schools, and school is opening next week. So it's really difficult, but we have to be able to have systems in place to address the levels of stress, responsibilities that are being added to those that are working in our schools, because there is a significant amount of chronic stress, compassion fatigue, and burnout amongst those that work in our schools. And when I talk about educators, I reference everyone that works in our school systems, because what we're seeing coming in through our system is every role within the school, from those that work in the classroom to those that work out of the classroom, those in administration, very high levels in administration, all the way up to executive leadership, which is great to see the vast range of educators coming into our system and asking for support. But it's very real to know that the support is needed, because it's a very difficult job. So that needs to be addressed. We're also seeing a lot of trauma that is being re-triggered, particularly over the last 3 years with the pandemic. And so understanding that those that are working in our classrooms, that are working with our students, if they are not okay, our students are not okay. We know that the well-being of educators is directly related and connected to student outcomes and to what happens in the classrooms. So districts need to have something in place to be able to address them. Grief and loss, I can see as well, has been, you can see has been also a big issue, and also something that districts need to address. We have seen increases in suicidal ideation amongst educators. You can see what it's looked like over the last 3 years. And so this can be something that speaks to the accessibility and visibility of something like the EASE program, and looking at stigma. People are really knowing that this program is out there, the resources are there, and reaching out and accessing the services. But what's really scary to know is that, what was it before? And so understanding that there's people that are in our schools that are really struggling and they need support, and it's important for the support to be there and be very easy for people to access. So in terms of educator mental health, I think that it's the most important thing is for it to be highly visible, easy to access, and there needs to be very limited waiting lists for people to be able to get in for services. Districts need to be able to create a culture of well-being. It can't just be the employee assistance program. This needs to be something that's fully integrated into districts and into schools. There needs to be training for educational leadership on how to take care of themselves as leaders, and then how to facilitate spaces of well-being for the spaces that they lead, the schools that they lead. And SEL training needs to happen for educators, with an emphasis on self-care as well, not just on SEL components for working with students. Looking at partnering with universities. I'm also on faculty at Cal State Los Angeles School-Based Family Counseling Program, which is a fully integrated MFT and school counseling program. which basically what this does is it trains marriage and family therapists and licensed professional clinical counselors to know and understand schools. And then it trains school counselors to have the clinical training on working with families within schools. Many university programs have applied learning spaces where they can provide training and partnerships with school districts. So I would encourage you all to seek out your local universities and be able to partner with them and letting them know what your needs are. And lastly, in terms of recommendations for student mental health, funding, it's been talked about, it's really important. Funding, nothing can really happen without funding. So looking at that funding, being involved with legislation, partnerships, coalitions, collaborations, so important. Like Dr. Katie talked about, paid opportunities, looking at how to incentivize the field, looking at facilitating counselor aid positions, counselor assistant positions, and really focusing on that school to work career pipeline, as some of my other colleagues have suggested. I'm happy to share and connect with everyone. Thank you all so much for your time. This QR code is to the EASE page.
I'm going to hand it to Dr. William Parham to introduce how we are also continuing to prepare counselors for the field.
My name is Dr. William Parham. I serve as a professor in the counseling program at the School of Education at Loyola Marymount University. I'm also the director of the Mental Health and Wellness Program of the National Basketball Players Association, and a position I've had for about 4 or 5 years. In addition, serve as a member of the Mental Health and Wellness Task Force for the United States Paralympic and Olympic Committee. I say all that because I think this is what we're going to be talking about, and what we have been talking about is certainly more global than domestic. And when I have seen other populations that have really captured my heart and captured all of us, we really don't yet have the tip of the iceberg. I want to also mention a mantra I invite my students. One of the courses I teach here is in trauma psychology. And invite my students to consider the following. Whenever and wherever shadows have been cast, it must mean that there's light nearby, because you can't cast shadows without light. And certainly if we look at these times with COVID and now monkeypox and what's going on in Russia, Ukraine, immigration, I could go on and on. We clearly have been in some dark spaces, and that's not to be taken for granted. I will talk a few minutes about how that has really pumped up the urgent call and clarion call for services. But the light about which I speak actually is in each of us and is in the people that we surround ourselves with. So let me segue into saying a couple things. Violence and trauma-informed education and service is hidden opportunities really to make a difference. Press the go, yeah, there you go. Trauma-informed school approaches grew out of a couple of situations. One, an awareness that children and youth increased exposure to violence, that there's no question that they have increased exposure, but also an acknowledgement that violence can have significant adverse consequences for children and learning. As we have heard before from my colleagues, there's clearly is a shortage of teachers, but there is also a failure in the system. I would argue, and I'm not asking each of you to believe it, it's just my opinion. I'm not at all convinced that the system has failed at really providing the necessary education and clinical resources for our population. I really do believe that the system has succeeded at not addressing the mental health issues of our whole constituency. So while there is a shortage, and related to the shortage is mental health service providers, as was also articulated. There's a dearth, social workers, psychologists, and psychiatrists, and there's not a beef in the pipeline. So the forecast is even more bleak. It's interesting to note that this correlation in the shortage of mental health professionals has led to a surge in mental health apps. My latest report is that there is an excess of 700. So our Silicon Valley brothers and sisters have been very active in really getting ahead of this and coming up with apps. I think those apps have a place. I'm not quite sure that they are the solution. There's a large body of research that suggests that trauma does not discriminate relative to gender, age, culture, race, etc., and other markers of personal identity. Thus, it seems reasonable to conclude that teachers, staff, administrators, and family are also impacted adversely by violence and trauma. So I'm advocating here a systems approach. So unfortunately, trauma is one of life's ever-present realities. Just a word about trauma. It is a deeply personal, that is for everybody, all of us on the screen experiencing the same traumatic event. We're likely to have at least 74 different reactions. It is uniquely nuanced, intricately emotional, and it results in a violent proprioceptive interruption. Proprioception is presence of mind, body, person, place, and situation. So it's an interruption in a person's physical, psychological, and existential being. And eruption is a word that's used deliberately because it just it erupts. There are environmental triggers, and there are abundant. And people can experience more than one trigger at a time. Traumatic experiences often exhaust the interpersonal resources and self-protective boundaries. And self-protective boundaries is something that's very, very important, that ultimately are obliterated when situations such as COVID takes place. But these keenly distressing and stark, surreal, instantly dramatic events that often happen in childhood, I see them, and my experience suggests that they are like invisible tattoos. For those of you in our audience who have tattoos, no one would ever know looking at you because you're clothed. But particularly those who have large, beautiful tattoos, my guess is that it really hurt when you got it on at some point in that journey of ink. You said, why am I doing this? But at the end of the day, it looked gorgeous and beautiful. But if you get tired of it 5 years, you can't erase it. On a like matter, each emotion that children feel during a violent, traumatic event, each emotion is equivalent to the well from which a tattoo artist draws ink to etch the indelible and invisible tattoos of remembrance that consequentially influences all choices that we have relative to relationships, family, or economics, educational, and other life challenges. So again, there is an urgent need to revise curriculum across areas of school-based specialties, goal-directed to better preparing professionals to respond to trauma situations that manifest on school campuses. At a minimum, counseling curriculum, or these curriculum should highlight key trauma theories framed across the developmental continuum. It should take a look at the adverse impacts relative to learning and teaching. The contextual factors should also be included, and there are at least 3 categories: the context of personal markers, the context of the environment, and the context of social media. The National Basketball Association, Players Association, just came out with the first of its kind report. It's actually FIFPRO, FIFPRO, the NBPA, and the WNBA came out with a 52-page report, first of its kind database report on social media, for example, of athletes and the abuse, social media abuse in athletes. I was so taken by that. We've distributed that now to colleges, and we're sending it also down to school systems. The social media is a bear of a challenge. And talk about silent sufferers. It's pretty important to take a look at that. Curriculum also should talk about trauma-informed emergency plans, and certainly, as mentioned by my colleague, self-care must be considered. Related, practicum, field placements, and internship experiences should include training and trauma-informed interventions. Okay, there we go. Okay, governing and licensing bodies of the aforementioned specialties might consider requiring completion of trauma-informed CE courses as prerequisites for certification. So what we're talking about here is not only is content learning in the classroom, experiential learning in terms of practical and field placements and internships, but also once you're a degree or certified or licensed, relicensure or recertification ought to require evidence that you have had trauma-informed education in some form. And likewise, departments should affiliate with faculty with content expertise in trauma and trauma-informed interventions and evaluation. So the final recommendations: know thyself. I can't underscore this enough, and often have my students memorize the following mantra. And just as a backdrop, when I say memorize, I invite my students to consider that the goal of memorizing is not to recall, not to remember, not to regurgitate. The goal of memorizing is to forget. Forget meaning to get so deeply ingrained you don't even think about it. So one of the 12 mantras they need to memorize is: a person will never see their reflection in running water. It is only when the water is still will a person's reflection begin to emerge. So with that, implementing daily routines of mindfulness, meditation, deep breathing, and self-care are recommended. Number 2, appreciate that context is everything. People quite simply cannot be fully understood and appreciated absent multiple contexts within which they navigate their circumstances and situations. Context should include culture, race, social class, gender, again, and other markers of personal identity, but should also include an examination of the assumptions and foundations of models of learning. Psychology: I am a licensed board certified psychologist, trained traditionally. But the models that I was trained under are pathology. If you understand the history of psychology, it borrowed heavily from medicine, which is under models of pathology, and pathology is the study of disease. Why is that important? Because since the dawn of the profession up until now, that has spilled into social work, marriage and family therapy, and all mental health forms, there's a predominance of pathology minded when you look at the titles and the labels, the diagnostic labels. All of that is very, very important. Which leads to my next point. I think it's important to begin to reframe the narrative. I think it's important to consider strength-based. I think it's important to consider mental health as mental wealth. It is the sum total of all emotional vitality which persons are always in possession of, even if they are unaware that they possess these gems of inner strength. We use the term mental wealth not only in good times, but we also see it in bad times, where you certainly can't fight the storm and the wind. You certainly can adjust the sail. So how we respond to life's challenges is where we find our strength. Mental health and wellness should also be viewed on a continuum. It is no longer acceptable to say you're depressed or you're not, you're anxious or you're not. It's really on the continuum from 1 to 10. People in the 8 to 10 range are functioning pretty well across domains of their life: work, career, relationships, etc. People in the 4 to 7 range are functioning pretty well. But there's one area, maybe two, that they're needing a little bit more trouble and they wish they didn't have to deal with, but they do. 1 to 3 folks are really struggling pretty mightily. And that needs to be adjusted. They certainly need the bulk of our help, but let's not forget, which is the last point here, an individual's or parent's survival and successful integration of their past into personal occupational success should not be interpreted as evidence that their invisible tattoos of trauma have been erased. Nothing could be further from the truth. I recommend that each of you on the screen become familiar with the ACE study. The ACE stands for Adverse Childhood Experiences. It was a joint program from 1996 to 1998 by the Center for Disease Control in Atlanta and Kaiser Permanente Hospital. Major study, close to 18,000 patients, One important fact is that each of you on this screen, of which there are 64 plus, if all of you were to go into your mobile phone directories right this minute and randomly select 100 people, randomly, all of whom presumably in your phone Rolodex are people you know and love, the data are exceedingly clear that 65 out of 100 of those people would have had from 1 to 4 adverse childhood experiences in their life, not uncommonly experienced before the age of 10. And why that's important is that we are all in the front line and really need to work hard. But let's not forget ourselves and the struggles that we continue to fight and overcome. Because if we can chart our own journey, then we'll have a roadmap for others. Thank you.
Supporting the field in whatever way, whether it is in school context or behavioral mental health context, that the primary work, we can say self-care all day, and also the work is in our own relationship with ourselves, our own relationship with our narratives, so that we can hold space for ourselves, so that we can be attuned into transference, countertransference, or ways in which the stories that we hold impacts ourselves. So I'm grateful. We had a question on, does your state differentiate certification for school-employed social workers versus community-based social workers, or any changes with the PPSC credential?
So in the state of California, we have one clinical license for the social work profession that's post-master's. That's the licensed clinical social work license. In other states, there are multiple tiers, and so that's how our state functions. And then we have the PPSC credential, which is an additional postgraduate credential that you can receive. And one of the barriers that I want to acknowledge, there was a question in the chat, and I wanted to pause for the end, but the PPSC is something that's been up for discussion, because a lot of schools intentionally look for LCSWs with PPSCs, and that's been a barrier to recruitment. Our position as an association is that we want to get rid of all barriers. We want, we want credentials, learning opportunities, professional development, all of that to be accessible and affordable. So that's to say, there is actually a bill that's being championed by our state superintendent, Tony Thurman, who is a social worker, and it's an educational stipend for those who are on the pathway to become a credentialed social worker. We launched what's called the Social Workers Movement, which is essentially our technical assistance arm, to also work with school districts and schools around integrating funding for access to things like the PPSC and licensure into the workforce experience, so that it's not something that is fully expected on the outset of recruitment, but it's something that is actually provided as an ongoing professional development and cultivation mechanism to support that individual into growth. So that we're essentially sort of sharing in terms of our system's responsibility to educate our professionals, and that burden doesn't fall on that individual themselves, particularly if we want to recruit from the community that we are serving.
I think more and more universities are offering fully integrated programs with the option of, looking at school counselors, the role and what school counselors do. The mental health background is, they are oftentimes the go-to, the experts to, in any type of risk assessment crisis, and so the importance of that mental health background is so important when you're working in schools. So I think more universities are looking towards those fully integrated programs, so people can go from community-based mental health settings, but also there was a point I think Deborah made earlier, or maybe Dr. Katie, that people feel most comfortable accessing these services through their schools. That's where their relationships are. That's where they have trust built. So being able to offer mental health supports and access through schools is really the best way to be able to connect students and families to services.
Thank you to this panel and to the kind of receiving a lot of information from higher education to pathways to licensure to pre-service education.